Good morning, everybody. I'm glad to see we have a lot of people that came back after last night. I had heard that there was some good times going on. Well, as Daniil told you, the action plan. I believe that this is a document that sets everything in motion for getting these monies out to the communities. And she also told you that there is a checklist that will be not only helpful to you, but that it is a template that you can follow in developing your action plan for those of you that have never done this before. And that checklist is included in the back of your, in the back of this presentation in your binder. You actually have that checklist in there, so you don't even need to go to our website. It is there. And the very first item on that checklist is the needs assessment. We heard that conversation yesterday afternoon with a panel that talked about how to look at that needs assessment. So that's the very first thing that starts out your action plan development. If you follow that outline, those questions in that template, you will have covered everything that is required for you to include in your action plan. This is the very same checklist that we will follow when we review the plan that you submit to us, to include even a page number. So when we're reviewing your action plan, we're following this checklist, and we actually make note of what page in your document is that subject covered on. And so this is the document that HUD uses to review your plan and to approve or return back to you if there's something that is not covered in there. So we go into the big picture. So we're going to determine the effects of the disaster. This is the very first step. How do we do that? Through the needs assessment. From there, we go to develop the plan to respond to the most critical disaster recovery needs not addressed by other resources. And thirdly, you implement the plan to ensure the activities are completed in an efficient and timely manner. Step one, what are the effects of the disaster? Again, goes back to your needs assessment. How did you determine what that disaster cost? And second, how are you going to develop the plan? So here we have a picture of a house that's in Bayville, New Jersey, a beach house. And yesterday when we were talking with Stan, he reminded us that although we're looking at a beach house here, mostly beach homes are considered secondary homes. And so under this notice, secondary homes are not eligible for assistance. Not always the case, but typically that's the case. So just because we see a beach home here doesn't mean that they're eligible for assistance. So here are some tools and references that you can use. The first one, the Disaster Relief Appropriations Act of 2013, which is the one that appropriates the money for this disaster. Then we have the federal notice, which was published March the 5th. This is in my estimate, this is your guide that tells you exactly what is required in every action plan. It tells you what you can do and what you may not do. And then again, the checklist that I had just talked about, which is the guide to assist the grantee and the reviewers, which would be HUD, in determining if you've covered everything that is required. So step one, assess the recovery needs after the disaster. Again, refers back to the needs assessment. How much damage there was, how did you determine this, what data were you using, all of that. So this is an evaluation of disaster-related impacts on a state, city, or the local communities. At a minimum, you must evaluate 3 core aspects of the recovery: housing, infrastructure, and the economy. In the area of housing, you need to evaluate the need for multiple types of housing to include public housing and assisted housing for the homeless. Under infrastructure, you're going to evaluate the needs for restoration of roads, bridges, and other public structures. And under the economy, you're going to evaluate job losses or losses in revenue. You also take into account other assistance that is available or likely to be available for affected communities and individuals. For example, FEMA funds that are available for public infrastructure, or insurance funds that are available for homeowners rehabilitation. Sometimes that can get a little touchy. We find that insurance companies sometimes get really picky about the things that they're going to cover. And so sometimes that can be a battle between the homeowner and your insurance company. I think the key for homeowners is that they not give up so quickly when they're told that's not covered. Sometimes you just have to dispute what your insurance companies are telling you and make sure that you understand what your policy covers. So why the needs assessment? Because money is scarce. There's not a whole lot of money with everything going on in our country. Everybody's fighting for every dollar. So we need to make sure that whatever assessment we're making can be justified and documented to ensure that these monies that we're putting out there, the CDBG disaster funds, are meeting the critical and unaddressed needs. So what is the purpose? Well, we want to use the best available data to identify and document the needs. And again, that goes back yesterday to the presentation that Todd was talking about, where they get the data. And also, just as a reminder, as he told you yesterday, that if there's any data that you need for your particular community or state, please feel free to contact them, and that they can provide a lot of this information for you. You don't have to go out and do a lot of research if this is already done for you. Anything that in your particular case is not available, then that's where you would come in and do your own assessments. And then you allocate the CDBG disaster recovery funds. And again, you have to illustrate the connection between the recovery needs and the allocation of funds. Evolving recovery needs. Disaster recovery needs evolve over time, and the needs assessment, the action plan, may need to be updated periodically. Again, I think Steve and Amanda's presentation yesterday talked about how when there are changes or you come up with something that you hadn't anticipated in your assessment, you may have to change or modify your action plan. And we expect this. We don't expect you to submit a document and that's just set in concrete. We know that sometimes you're going to miss something in your assessment, or perhaps you think a plan is going to work for you, and once you start to implement that, you find out that it's not the best plan. So you have to go back to the drawing board and make some changes to your action plan. Any questions that you may have on the data, you can also contact FEMA and SBA for additional unmet housing and business needs data. And in your notice, in the notice that's published March 5th, they actually give you two contacts, one for SBA and one for FEMA. They give you the name of the individual as well as telephone numbers and email addresses. So that leads us to step 2, developing the plan. So we go back to the research. Using needs assessment, ascertain what types of activities or programs will best address the grantee's unmet recovery needs. So if you see the tie, we keep going back to the needs assessment. That tells you this is the very first thing that you need to do when you start looking at developing your plan. And as I said before, in your checklist, this is the very first item that's on that checklist, the needs assessment, and there's 6 or 7 categories under that. Get as much input as possible, reach out to the affected communities and to the citizens, talk to the existing grantees, what has worked well for them, what didn't work so well. Yesterday evening in the panel, I think GLO touched on that a little bit, how they thought something was going to work really good for them and they found out it didn't work so well. So again, I encourage you to talk to the existing grantees, pick their brains, find out how they did it, what worked well, what didn't work well. Don't be embarrassed to ask what sometimes we may consider a stupid question. There are no stupid questions. So ask away. So what are allowable activities? All activities must clearly address an impact and show a tie to the disaster. Each activity must be CDBG eligible or have received a waiver, meet a national objective, and address a direct or indirect need. I think the city of Minot talked about that direct and indirect need yesterday when she was referring to the houses that were damaged. And because of the volume of damage, it created a need to create a new landfill. That would be an indirect activity. So these are the links where you can actually go in and again get a lot of this information. Talking about the Housing and Community Development Act, it gives you a link to that. And the next one, the Guide to National Objectives and Eligible Activities for State CDBG, and one for the entitlement communities. Those will actually give you all the activities that are eligible for this funds. And once you've looked through that, if you feel like you have something that is not covered and you think you might want to cover it, then you can talk to HUD and find out if there's something that we can help you with in that area. So we go to national objectives. The grantee must document that each eligible activity meets a national objective, and there are three. The first being that it benefits low and moderate income persons, that it addresses an urgent need, or that it aids in the prevention and elimination of slum and blight. For an in-depth discussion of national objectives, look at the guide on the national objectives and eligible activities. So with that, I'm going to turn it over to Donna, and she will continue the presentation. And I know everybody's still half asleep, so any questions that you have, we'll take right after the presentation. Thank you.
Thank you, Grace. Good morning. Okay, so now we're talking about the tie to the disaster. The grantee must demonstrate how each activity is tied to the disaster, and this has to be documented both in the action plan and in the activity files once you begin your projects. Did I hit the wrong button? Okay. Ways to distribute funds. The funds can be distributed by the local government to carry out the activities directly, or the state grantee can determine if they want to use a method of distribution or if they want to carry the activities out directly or do a combination of both. And the state has the ability to use a couple of different avenues compared to what the local government is able to do. Method of distribution. The state grantee can award funds to local governments based on damage estimates. They could use a method of distribution, say for an infrastructure project, and that could be for the whole state, and that can be an activity that they choose to run, or they may use a method of distribution for all of the funds to ensure that the funds are adequately dispersed and used to identify, to address the identified needs from the assessment. There are pros and cons to using a method of distribution. Using the method of distribution, you can get the funds out to the state can get the funds out to the local government quickly. They have flexibility in determining what the most critical needs are. Some of the cons, it's strictly competitive, and it could lack a clear connection between the activities and the recovery needs. It requires significant oversight to ensure that all the applicable state and federal laws and regulations are adhered to. Direct implementation. The grantee, including states, can design and carry out activities directly. Typically, this means that the grantee can develop the activity or the programs, review the submitted applications, and monitor the applicant, et cetera. So they have oversight, and they're able to ensure that all the requirements are met for administering that program. They can use a subrecipient or procure contractors. They can, but the grantee still remains responsible for ensuring that all the responsibilities are met in administering those funds. Pros and cons to direct implementation. They're able to develop and implement specific activities that narrowly are tailored to meet identified needs. Say they have a need for infrastructure or economic development in the state. If they do direct implementation, they can address those needs and ensure that those needs are met. One of the cons, the significant capacity needs to design and implement the program may be delayed with initial expenditures and could increase the administrative expenses by not doing that. The state grantees can design an activity or a program using a method of distribution to award these funds to the local government. An example is Ohio may design an economic development program that uses a method of distribution to award funds to eligible local governments. Pros and cons. They're able to develop and implement specific activities and programs, like we did this already, that meet the identified recovery needs. Units of local governments are responsible for the day-to-day administration of specific activities, and that's oftentimes a good thing because they're on the ground and they know what those needs are and they know how best to address those needs. One of the cons, there may be a disconnect between the state and the local government in terms of communication. So that could present a problem. Citizen participation. Prior to the submission to HUD with the action plan, the grantee is required to put the action plan out for public comment. The notice requires that the action plan goes out for a minimum of 7 days. However, as it was mentioned yesterday in one of the presentations, the grantee can extend that time to go beyond 7 days if they feel they need more time. The action plan must address all comments that are received through the public comment period. And not only, and when I say address, that means that they need to respond to those comments as well and include those in the action plan that they submit to HUD. DR-GR action plan. Once the published action plan is accepted by HUD, the grantee enters the information into the DR-GR, it's a disaster recovery and grants reporting system. That information also goes into that system. HUD will review the action plan when it's approved and those funds are made available. So the action plan is accepted by HUD and then the action plan is entered into DR-GR. And there's more specificity in the action plan for DR-GR. You go down to the level of activities, performance measures, things like that, and that's not in the action plan that's submitted to HUD. Key difference in the published action plan, as I just mentioned, there's more specifics in the DR-GR action plan. The action plan that's submitted to HUD is more of a macro view of what the recovery needs are. Each activity must have a start and end date. Although timeliness is waived, grantees still have to ensure that the activities are completed in accordance with their performance measures. The Appropriation Act requires the grantees to expend these funds within 2 years of the date that HUD signs the grant agreement with the grantee. And just a little note on that, that date is also the date of obligation. So the date that the HUD signs the grant agreement is the date of obligation, and that's when the clock starts ticking. The performance schedule, the action plan must be updated to include the grantee's expectations for performance. And as Grace mentioned earlier, oftentimes the grantee may find out that the needs, recovery needs may change a little bit from what they saw when they did their needs assessment. So at that time, then that's when the changes can be made to the action plan to ensure that all recovery needs are made. The action plan must include the projected expenditure schedule for the entire grant. And if you need guidance on that, it can be found at the CDBG Disaster Recovery website. Each grantee receiving an allocation under this notice must submit the action plan within 90 days of the effective date of the notice. Timeliness. HUD requires, the 104E of the Housing and Community Development Act requires HUD to determine whether the grantee has carried out its activities in a timely manner. The department will, absent substantial evidence to the contrary, deem a grantee to be carrying out its program activities in a timely manner if its performance schedule is substantially met. So that's how we measure timeliness. Again, we don't look at what's required by the Act, but we do require you to meet the, to adhere to timeliness in accordance with your performance schedule. This is a resource for you, the CDBG Disaster Recovery website that includes the appropriation laws, the Federal Register notices, contact information, action plans, quarterly reports, and also it has your peer CDBG grantee contacts and your HUD CPD contacts. And at this time, we'll take questions on the action plan. Thank you.
No questions?
Well, if you don't have questions right now, we are going to go into the roundtables, and at that time, we are all available to answer any questions that you may have. No questions? One last time? Okay. It's in your binder. Oh, electronic copy? Can we do electronic copies?
All of the slides and PowerPoint presentations will also be posted on our website. And in fact, once you have the chance to go, all of our previous slides from other trainings are posted there. So you'll see a new link for 2013 training, and the electronic versions of the presentations will be included on the website.
I do have a question for Donna. On the, can you just reiterate about the obligation date? Is the date that the grant agreement is signed?
Right. The date that HUD signs the grant agreement is the date that is the date of obligation, and that's when the clock starts ticking for the 2-year requirement to have all funds expended.
Thank you, Donna. Hold on. Mike is coming.
All right, I'll ask the burning question. Is admin subject to the 2-year expenditure?
Yes,
Yes.
all funds have to be
So we have
expended.
no money to monitor after that 2-year period is done.
That is correct. Yes. Go ahead.
I saw a copy of the action plans for, I think, New York and New Jersey, and it was more on a format of a narrative kind of thing. So when does the transition to meet the action plan that goes in the DRGR, when does that take place? Or is that in the submission?
Typically, as I said earlier, the action plan that's submitted to HUD is a macro view of what the recovery needs are. But as you develop your projects, as you begin to identify specific activities, then that's when those changes will come about, and you'll put them into the DRGR reporting system. Did I answer your question? Is that?
I think so. So the details will come after the action plan?
Right.
Someone just asked about admin and whether the 2-year mark and what you said was absolutely true. But bear in mind that this notice allows you to submit it in the form of a partial action plan. So you can actually submit a partial action plan for part of your admin. So bear that in mind. So if you do it that way, you can stretch it out a little bit. But yeah, everything that you submit to us and a grant agreement is signed on, you have 2 years to spend it.
Yes.
When you're looking at the updates on the action plan and DRGR, how can you tell what areas have been updated? When you're looking at the updates in the DRGR system to the action plan, how can you tell where the changes have been made?
Typically, we can't tell unless you tell us what changes you're making, and that's what we ask the grantees to do. When you make an update on your action plan, you need to let HUD know what changes you've made. Otherwise, we have to review the entire plan again to see what changes were made. You'll get a much quicker turnaround time in the approval if you let us know that you changed project A, B, or C, or whatever change you made. You let your CPD rep know so that they can go in and review that particular item and get your plan back to you on an approval status.
Okay, so the grantees should be tracking that.
Absolutely. Al?
It's my understanding that you can, the last date you could submit an action plan amendment is June 1st, 2017. Is that correct?
I'm not sure about that, Amanda.
Yes.
Obligation.
The last date you can submit an amendment to your action plan is June 1st, 2017.
That is correct, and that's because the date that HUD has to obligate all the funds is September 30th. So in order for us to meet that deadline, the very last date for any action plan, or excuse me, for any submissions needs to be that June 30th deadline. Because HUD only has until September 30th, 2017 to obligate the full amount of that first tranche of
So, okay, so if you submit a partial action plan June 1st, 2017, that means you have to what, May 30, 2019 to spend that money, right?
Oh, your 2-year deadline?
Yeah, 2 year.
The 2-year clock is when we sign the agreement with you.
Okay.
So whenever we actually execute that agreement, that's 2 years from that date.
Okay.
To expend the funds. Obligate is just the date that you signed the agreement with us.
Yeah.
Expend is the date from which we entered into the agreement with you, the grantee, 2 years after.
Okay. So technically, you could go to 2019.
If you wait until that extended period,
Yeah.
to submit your last action plan,
Yeah.